Hi, my name is Laura Drexler. I'm an educational therapist, and my journey towards education began quite a few years ago when I attended Cal State Northridge and I got my master's degree in communicative disorders. And from there I got a teaching credential and I worked with special education students for many, many years. And after that, I decided that I wanted to bring my skill set to the private sector, and about 10 years ago, I began my educational therapy practice. Once your child is involved in the educational therapy process, the role of the parent is very important. It's important to follow the suggestions that are made, try to the best of one's ability to set specific times and rules for when homework is done, to use time wisely, to have places in the student's home where they can sit down quietly and turn off all outside distractions, and really to follow the recommendations made by the educational therapist. Ideally, again, depending on the individual needs of the student, sometimes a therapist is part of the team. Sometimes a psychiatrist might be part of the team if there is medication that is part of what is needed to help a student. A nutritionist, a hypnotherapist, or perhaps an outside tutor to help remediate a specific subject area. It's a team approach, and certainly what I pride myself in is being a team player and having tremendous connection to the entire team, including the school and the teachers. Whenever I get a new referral, I pride myself in immediately establishing connection with support staff at the school. From there, depending on what the school wants or needs, we either set up an individual meeting at the school with all the various teachers to make sure that the student is receiving the important accommodations that they are entitled to, and from that point, emailing the teachers so that we again have open communication and dialogue to help support student success. Many people confuse the difference between educational therapy and tutoring. Educational therapy is an umbrella term that encompasses many things, such as learning disabilities, problems with reading comprehension, written expression, auditory processing, verbal expression, mathematics disabilities. There's a whole myriad of things that fall under the term of educational therapy, including lack of organization, lack of time management skills, lack of self-advocacy skills. Tutoring, on the other hand, is specific to a subject. For instance, if a student is having difficulty in math, they should probably see a math tutor, because it is important to build the foundation and the building blocks of that subject so that the student can continue to advance year after year. However, the difference between educational therapy and tutoring is that educational therapy teaches a student to empower himself and how to do school. The skills that I teach my students can be applied across the board to every subject that they have. There are many telltale signs that a parent should look for if their student is struggling and might need the assistance of an educational therapist such as myself. The attitude, "I hate school," not being able to sit in a chair and focus, not being able to manage the moving parts, the homework, getting the homework turned in, disorganization of a bedroom, a backpack, a notebook, not being able to follow directions, not being able to put ideas into cohesive words that make sense, starting to get negative feedback from the teacher saying, "Johnny can't sit, Johnny can't get the homework done, Johnny is not able to retain the information that was just taught the day before." There's so many telltale signs that might indicate that calling someone such as myself might be indicated. I believe that parents know. If you believe that there is something that is not quite right with your student, my suggestion is to call me and I will help you figure out whether or not your student would benefit from educational therapy services. By a holistic approach, I mean that I see myself as a mentor, a coach, a cheerleader to help empower students to believe that they can succeed no matter what the diagnosis. Oftentimes, students that are very high functioning need or want to fine-tune what they are doing so that they can set their sights on attending a university. I have had the pleasure of seeing many of my students go on to fabulous four-year universities across the country, where I still am coaching them and helping them via Skype to fine-tune their reading comprehension and their writing skills. I have been lucky enough to have some of the top schools in Los Angeles refer to me because I have a proven track record. The students that I work with come back to the classroom, they demonstrate mastery of their skills, their grades start to go up, they start to self-advocate, they have more confidence, they're more motivated. And in addition to that, many of my students go on to four-year universities. That's why I continue to get amazing recommendations from the schools in Los Angeles. The measurable and meaningful improvements that parents and students can start to see as a result of educational therapy are many, starting with implementation of a plan, developed organizational skills, a self-empowerment, a belief in oneself to say, I can do this, feeling good about the effort that you're putting into it, demonstration on tests and essays and quizzes that are improved, an overall improvement in one's attitude, I think, are all of the benefits from educational therapy. Hello, I'm Laura Drexler. By working closely with your student, I can help identify and correct specific skill deficits that may be contributing to your child's social and educational challenges. In an environment of safety, respect, and non-judgment, I will help your student find and realize his or her potential by way of meaningful and measurable results. I do look forward to speaking with you.